Hi students, this is Dr. Sunil, Professor of Physiology. Welcome to my YouTube channel, Dr. Sunil's Physiology Lectures. Today I am going to talk on the cardiac action potential. Cardiac action potential are of two types. One is fast response action potential. Another one is there that is slow response action potential. The fast response action potential, it is seen in atrial and ventricular muscle as well as in the Purkinje fibers. Here the depolarization is very fast, little bit more steeper because of the opening of fast sodium channel, which are very fast to open as well as very rapid to close also. Slow response action potential, here the depolarization is little bit slower, less steeper compared to the fast response action potential, and it is because of the opening of slow calcium channel. This slow response action potential is seen in the nodal tissues like SA node and atrioventricular node, that is AV node. Let us see one by one these two types of the action potentials in the heart. First we'll see about the fast response action potential and later we'll do about the slow response action potential. What are the components of fast response action potential that is seen in the ventricular muscle? Let us see the phases of the ventricular muscle action potential. What are the 5 phases? So if you see the action potential of ventricular muscle, there are 5 phases are there. Start with phase 0, that is called as rapid depolarization phase. Then the next phase where the membrane potential little bit becomes more negative but is not complete. It will not come back to the resting membrane potential. This is called as first rapid partial repolarization. Then phase 2 where there is a sustained depolarization, membrane potential is sustained. This phase is called as plateau. Then the third phase is there where the repolarization will complete. This is called as final repolarization. It is also called as second rapid repolarization because there is already one rapid repolarization is there, though it is partial, but here in phase 3 the repolarization will complete, that is a rapid one. And phase 4 is the polarized, that is a resting stage. It is a stage of resting membrane potential. Let us see one by one what is the ionic basis for each phase. So this is the action potential in ventricular muscle. Start with the phase 0, that is the rapid depolarization phase. It is a little bit more steeper because of the opening of fast sodium channel. Then after that there is a first partial rapid repolarization. Then the depolarization is sustained, that is called as plateau phase. This is followed by second rapid repolarization, that is the final repolarization phase, phase 3. And after that it is followed by a resting phase, that is the phase of polarized phase, that is resting membrane potential. Now we are going to see about the ionic basis for each phase. The phase 0 start with rapid depolarization. It is because of the opening of fast sodium channel. So the sodium ions will enter inside. So inside of the cell membrane becomes positive. So the membrane potential will rise fast. It will go above the 0 millivolt. Then the phase 1, this is the phase of partial rapid repolarization. It is not complete, so it is called as partial. So at the end of this phase 0, this fast sodium channel will close and there is an opening of one type of the potassium channel, that is called as transient outward potassium channel. Because of this the potassium ions will go out, but this transient outward potassium channel, it will open on depolarization at the end of depolarization, but it gets rapidly inactivated. Then phase 1 is followed by sustained membrane potential phase, that is called as plateau. So at the end of this phase 1, transient outward channel will get closed now. So there is an opening of another channel, that is called as slow calcium channel. It is also of one type that is called as L type calcium channel, long lasting calcium channel. It is also called as slow calcium channel. It gets open at the end of this phase 1. So slowly calcium ions will enter inside, but along with the calcium influx that is occurring through this calcium channel, there is also the opening of potassium channel also. So there is a one type of the potassium channel that is open. It is called as slowly activating potassium channel. It is also called as a delayed rectifying potassium channel. So the potassium channels are open, so potassium ions are going out and calcium ions are also coming in because of the opening of calcium channel, that is slow calcium channel or L type calcium channel. Because of this, calcium is coming in, potassium is going out, so the membrane potential will not be changed so much, so that is the cause for plateau phase. Then the phase 3, that is the second rapid repolarization phase, it is also called as final repolarization phase. Here slow calcium channel which is open in the plateau phase, it gets closed there, but there is the opening of potassium channel, so there is an increased permeability of the cell membrane to potassium ions, so potassium ions are going out. Here another one channel is open along with this delayed rectifying or slowly activating rectifier channel. This is called as inwardly rectifying potassium channel. So opening of these two channels, both are potassium channels, potassium ions are going out, that is called as potassium efflux. So the membrane potential will going down rapidly to the resting phase. And finally the membrane potential will go and stable at the resting membrane potential level, that is at minus 90 millivolt. And this is because of the activation of sodium potassium pump, which will be pumping the excess sodium ions out in exchange for potassium ions that are coming in. So these are all the phases and ionic basis for the ventricle muscle action potential. So this is how the membrane potential will go out whenever the ventricle muscle is activated. The first phase is start with the phase of rapid depolarization, then the first rapid partial repolarization, then the membrane potential is sustained, that is called as plateau phase, then it is followed by second final repolarization phase and it will come back to the resting level then. So to summarize, ionic basis along with the phases of action potential, phase 0, it is because of the opening of this fast sodium channel. The phase 1, that is the first partial rapid repolarization, it is because of the opening of one channel, it is called as transient outward potassium channel. So at the end of the 0 phase, sodium channels will close and this transient outward potassium channel will open. As it is transient, name suggests, it opens for only short period because it gets inactivated rapidly. After the end of this first phase, the plateau phase will start. It is because of the opening of L-type long-lasting calcium channel, which will allow the calcium ions to enter inside the cell membrane. Along with this, there is also opening of the potassium channel. It is that potassium channel is called as slowly activating or slow delayed potassium channel. So the potassium ions are going out, calcium is coming in, so the membrane potential will remain sustained. Then at the end of this plateau phase, the calcium channel will close. It is slow or L-type calcium channel. And there is opening of two types of the potassium channel. One is delayed rectifier or slowly activating potassium channel along with the inwardly rectifying potassium channel. Because of this opening of these two types of the potassium channels, potassium ions will be going out rapidly, so the membrane potential will come back to the resting level, that is the RMP stage, that is minus 90 millivolt. So this is the phase of rapid repolarization, and the fourth phase is because of the activation of sodium potassium pump, which will maintain the membrane potential at minus 90. So whenever the next action potential comes from the SA node and whenever the ventricle muscle gets excited, again there is a formation of another new action potential. Okay, so we have done now the fast response action potential. Now we are going to see about the slow response action potential that is usually seen in the SA node along with the AV node. So let us see the SA node or pacemaker action potential. What are the different phases or components? This slow response action potential, it is having a unique property. It is caused by these pacemaker tissues like SA node and AV node, which are autorhythmic cells. They will initiate its own action potential without any extrinsic influence. Means it is having a spontaneous activity to form a action potential. There are no any extrinsic factors required to form a action potential. Wherein in the ventricle muscle action potential, fast response action potential, it is always stimulated by the action potential that comes from the SA node. It doesn't have any autorhythmic property. And here the resting membrane potential, it is not stable. It is usually called as restless. In case of ventricle muscle, the membrane potential always remains stable at minus 90 millivolt. But here, the membrane potential is not stable, it is always restless. As soon as the membrane potential reaches the resting level, again the membrane potential will slowly going down to the threshold level and there is a formation of new action potential. So here the membrane potential of the SA node or AV node doesn't stop at the resting level, it will slowly rise to the threshold. This is called as pacemaker potential also. So there is a slow spontaneous depolarization is there. This is because of this unstable resting potential that is not there in the ventricle muscle action potential. And here for the depolarization phase, instead of sodium ions or sodium channels, it uses slow calcium channels for the depolarization phase, means rising phase of action potential. Okay, as these calcium channels are slow to open, so the rising phase, that is the depolarization phase, is a little bit slower and less steeper compared to fast response action potential. So this is how the SA node action potential or pacemaker action potential. Here only the three phases are there. If you compare with the ventricle muscle action potential, there are 5 phases are there. Here only 3 phases are there. First phase to start with the phase 0. This is the depolarization phase. Little bit it is slower one and less steeper. Then the depolarization, that is phase 0, is followed by the phase of repolarization. And once the membrane potential in the repolarization nears towards its resting level, that is the minus 60, there is a start of slow spontaneous depolarization. Here the membrane potential doesn't stop at this level. It is not stable. It is always unstable, that is restless. As soon as the membrane potential reaches the minus 60 at the end of this action potential, that is phase 0 and phase 3, depolarization and repolarization, here there is automatically slow depolarization occurs and the membrane potential will slowly come back to the threshold. Once the threshold potential is reached, the new action potential is generated. Again at the end of the repolarization, that is at the end of action potential, again the new slow spontaneous depolarization occurs. This slow spontaneous depolarization here, this phase 4, this is the special property of the SA node and AV node only, and because of this the autorhythmicity is maintained. It doesn't require any extrinsic stimulus. Let us see all the 3 phases and their ionic basis. Start with this phase, that is the phase of slow spontaneous depolarization. At the end of action potential, membrane potential will come back to the minus 60 millivolt. It doesn't stop here. The membrane potential will slowly rise and it will go down to the threshold level, that is the minus 40 millivolt. So here the membrane potential will come back to the minus 60 at the end of action potential, and after that there is a slow spontaneous depolarization occurs. That slow spontaneous depolarization between the action potential is called as pacemaker potential. Let us see the ionic basis for that. Now here actually there is no any resting membrane potential in the SA node. Usually it is minus 60. Whenever the membrane potential reaches minus 60, the membrane potential will start rising slowly without any extrinsic influence. So there is a restless, unstable resting membrane potential. So at the end of action potential, this phase 4, that is the phase of pacemaker potential, will start. This is also called as phase of slow spontaneous depolarization or pacemaker potential. After the end of this phase 4, that is the pacemaker potential, action potential will start. So this is also called as pre-potential. Pre means before the action potential. So this is the special property of the SA node, where the action potential is generated on its own, and this is caused by this spontaneous slow depolarization. It is also called as pacemaker potential. Here there are two reasons are there why there is a slow spontaneous depolarization is there. At the end of this action potential at minus 60, one change occurs. The potassium channel which is open on repolarization gets closed here at the level of minus 60. Along with the closure of potassium channel, there is the opening of another channel that is called as funny channel or funny current. This is nothing but the slow sodium channel. Usually the sodium channel is open on depolarization when the membrane inside of the membrane becomes positive. Here what happened, the sodium channel is open on hyperpolarization when the membrane potential becomes more negative. So this is a little bit strange, so it is also called as funny channel. This funny channel is also called as HCN channel, hyperpolarization activated cyclic nucleotide gated channel. Whenever the cyclic AMP concentration in the cell increases, this will cause the opening of this channel. So it is called as hyperpolarization activated cyclic nucleotide gated channel, and it also opens on hyperpolarization also. So it is also called as IH channel because it opens on hyperpolarization. H stands for hyperpolarization. It is also named as funny channel. I means current channel. F stands for funny because the sodium channel opens on hyperpolarization. That is a little bit strange, funny. So at the end of the action potential, when the membrane potential reaches minus 60, there is a closure of potassium channel along with the opening of this sodium channel. So at minus 60 millivolt level, sodium ions will slowly coming inside the cell membrane. So the membrane potential will slowly rise and it will go back from minus 60 to minus 50 level. Okay. From the minus 60 to minus 50 millivolt change, there is a requirement of funny channel. So this funny channel is open, and that will make the membrane potential to rise from minus 60 to minus 50. Okay. So this is the main cause for spontaneous depolarization at the end of action potential, closure of potassium channel and opening of funny channel. Now the membrane potential will go down slowly from minus 60 to minus 50. Here the threshold for the generation of action potential is minus 40. Still the membrane potential is a little bit far away from the minus 40. Now the membrane potential has gone up to minus 50 from minus 60 millivolt. And this is caused by this opening of funny channel along with the closure of potassium channel. Now what will be the next one which will make the membrane potential to rise from minus 50 to minus 40? Then only the action potential is generated. Let us see what is the reason why the membrane potential will rise from minus 50 to minus 40 millivolt. So the threshold level is reached. Now the next one we have to see is how the membrane potential will go up from minus 50 to minus 40 level. So this is because of the opening of one type of the calcium channel that is called as T type, transient type calcium channel. So at minus 50 millivolt, this channel gets open, and because of this calcium ions will enter inside. So the membrane potential will slowly move down from minus 50 to minus 40. Okay. So this pacemaker potential, that is a slow spontaneous depolarization, is caused by two main reasons. The initial part minus 60 to minus 50 millivolt is caused by opening of funny channel, sodium channel. They are not fast, they are slow to open. So the membrane potential will rise slowly from minus 60 to minus 50. At minus 50 level, this type of the calcium channel will open, and here at minus 50 this funny channel, sodium channel, will get closed. So the calcium will enter through this T type. As it is transient, means it will open for a short period, and because of this slow calcium influx, membrane potential will go down to the minus 40. Then the threshold is reached now, minus 40. Now there is the action potential formation. So the phase 0 will start now from here. That is called as phase of depolarization. It is caused by opening of second type of the calcium channel. It is called as the long lasting or L type calcium channel. Again, this is slow one, so the membrane potential will rise little bit slowly and less steeper compared to the fast response action potential depolarization. So the calcium ions will move slowly to the inside. As it is movement is slower one, so the rate of repolarization is little bit slower. So this is the phase 0 is there, what you are getting here. Once the membrane potential reaches minus 40, because of this slow spontaneous depolarization, slow depolarization occurs. You can see here the depolarization is not vertical or steeper one, it is little bit slower one. This is because of this L type calcium channel which are slow to open, so the calcium ions are going slowly inside. So membrane potential will become positive slowly and will come back to the above 0 millivolt level. Then at the end of this phase 0, the calcium channel will close. Which calcium channel will close? This L type calcium channel. Then it is followed by the downstroke, that is the repolarization phase. This is the repolarization phase. At the end of this depolarization 0 phase, this calcium channel will close and there is opening of another channel that always causes the repolarization, that is opening of potassium channel. So because of the opening of potassium channel, potassium ions will go out, potassium efflux will be there, and as the potassium ions are going out, inside of the cell membrane becomes more negative, because the anions present inside the cell will not go along with the potassium to the outside because they are impermeable. So inside becomes more negative. So membrane potential will slowly come back to the again which level, minus 60, or may it becomes little bit negative to the minus 60 also. So once it becomes minus 60 again, the new spontaneous depolarization phase will start because of the opening of funny channel, and at the end of this repolarization phase, the potassium channel will close here and there is opening of this funny sodium channel, and it will make the membrane potential to rise from minus 60 to minus 50 slowly, and at minus 50 level again there is opening of one channel, T type calcium channel, wherein the funny channel will close there at minus 50 millivolt level, and this T type calcium channel, that is transient type calcium channel, will make the membrane potential become more positive because of calcium influx, and it will bring the membrane potential back to the minus 40. Again there is a new action potential is generated. So this process will be occurring at a rhythmic fashion continuously because of this pacemaker or slow spontaneous depolarization, and this phase is occurring before the action potential. So this pacemaker potential is also called as pre-potential. This phase also coincide with the diastole phase of the ventricle. So this is also called as a diastolic depolarization. Okay, I hope you understood this action potential both in ventricle muscle and in SA node action potential. So this is how we can get the complete action potential of SA node. Same is there in the AV node, little bit it is slower one. So this is the phase of depolarization, this is the phase of repolarization, that is the action potential. At the end of this repolarization, potassium channel will close. Then the first one what we are getting is opening of funny channel. So the membrane potential will slowly rise to the minus 50 level. At minus 50, this funny sodium channel will close. There is opening of T type calcium channel that will bring the membrane potential slowly to the minus 40. Once it becomes minus 40, the L type calcium channel will open, and that will bring about the slow depolarization. At the end of this slow depolarization, calcium channel will close and there is opening of potassium channel, which will bring back the membrane potential to the again minus 60, again there is a slow spontaneous depolarization, that is a pacemaker potential. This will bring the membrane potential again back to the threshold, again there is a new action potential is generated. So this will be occurring in a rhythmic fashion. So this property of SA node is called as autorhythmicity, which will bring about the continuous action potential in a rhythmic fashion. Okay, and this pacemaker potential will also determine the number of heartbeats, that is the heart rate also. And this is the one phase that is more important for the how many action potentials are generated in 1 minute. Suppose this slope, that is the slope of pacemaker potential, becomes more steeper, means more vertical, so the membrane potential will become very fast to the threshold, so the number of action potential will be more in 1 minute. And opposite will occur if the slope of the pacemaker potential is very flat one, it is coming very slowly to the threshold, then the number of action potential per minute will decrease, so the heart rate will also decrease, because one action potential will be followed by one heartbeat, that is one contraction. Okay, so number of action potential per minute will determine the heart rate. So this slope of the pacemaker potential is altered by many factors. One factor is the role of autonomic nervous system. So here the sympathetic nervous system and the parasympathetic nervous system are both the branches of the ANS autonomic nervous system supply the heart. Sympathetic nerve fibers will originate from T1 to T5 thoracic segment, and the parasympathetic supply to the heart is through the vagus, that is the 10th cranial nerve. So this middle one what you are getting is the normal pacemaker action potential, this black one, and this is the slope of the pacemaker potential, that is the pre-potential or slow spontaneous depolarization. Any factors that will make this slope more steeper, what you are getting in the first one, the action potential will be reaching, action potential generation will be very much fast, because the slope of the pacemaker potential will bring the membrane potential very fast to the threshold, so action potential will be generated very fast. Opposite will be there, what you are getting in this third graph. Here the slope of the membrane, this pre-potential or pacemaker potential is almost, it is flat. So this membrane potential from minus 60, it will be taking more time to reach the threshold. So action potential formation per minute will be decreased, because it is coming very slowly to the threshold. So action potential will be forming also, will be formed very slowly. So these are the two main factors that affects the slope of the pacemaker potential. One is sympathetic nervous system activation, another is parasympathetic system activation through the vagus. So whenever the sympathetic nervous system is activated, this will make the slope of the pacemaker potential almost vertical, that is very steeper. So the membrane potential will move fast to the threshold. So action potential is generated very fast. So number of action potential per minute is increased, and that will also increase the heart rate. So under the influence of sympathetic nervous system, as the pacemaker activity is increased, because the slope of the pacemaker potential is increased, the membrane potential will come back to the threshold very fast. So heart rate will increase, because of the number of action potential per minute will also increase. The reverse will occur under the influence of vagal stimulation or parasympathetic stimulation. Under the parasympathetic stimulation, this phase of the pacemaker potential almost remains flat. The membrane potential will take more time to reach the threshold. You can see here, this is falling behind the normal pacemaker potential as well as the action potential of pacemaker tissue. So here this green one, it is almost remains flat. It is taking more time to reach the threshold. So the action potential generation will be very much slower one. So number of action potential per minute will decrease under the influence of parasympathetic stimulation. So heart rate will decrease because of vagal activity if it is increased. So this is how this vagus will make the phase of phase 4 becomes almost flat, and that will decrease the number of action potential generation. So this is the main factor that affect the slope of the pacemaker potential, that will make the heart rate either increase or decrease. Let us see the mechanism why the parasympathetic or sympathetic stimulation will make the slope of the pacemaker potential either flat or steeper. Let us see first parasympathetic stimulation, that is through the vagus. At the vagal endings, the one neurotransmitter is released, that is the acetylcholine. This will act on the cell membrane of the pacemaker tissue, that is SA node, and the receptor on which it acts, it is the muscarinic receptor, that is M2 receptor. And because of the activation of muscarinic receptor M2, there is an opening of one channel, that is the potassium channel. So because of the potassium channels are open, the potassium efflux occurs. So more potassium is going out. So the membrane potential gets hyperpolarized at the end of action potential. And this activation of muscarinic receptor, there is also decreased concentration of cyclic AMP. This will also decrease the calcium influx, because whenever the cyclic AMP concentration is more in the cell, calcium channels are also more in the increase open in the cell membrane. As the muscarinic receptors are activated under the influence of acetylcholine, there is also less formation of cyclic AMP. So the calcium channels are also less open. So less calcium influx and the membrane is hyperpolarized. This will make the membrane potential to go very slowly to the threshold level. That is, the slow spontaneous depolarization will get very slower one to reach the threshold. So the number of action potential per minute is decreased. Now we'll see the effect of the sympathetic stimulation. At the sympathetic nerve endings, postganglionic fibers, norepinephrine is released. It will act on its receptor beta 1 adrenergic receptor, and because of its activation, the cyclic AMP concentration is increased through the activation of adenylyl cyclase enzyme. More cyclic AMP means there is a more opening of calcium channels in the cell membrane. So more calcium influx will be there. Along with there is also opening of funny channel also. As I already mentioned, this funny channel is very important for the initiation of pacemaker potential. And after that, the calcium ions that enter will complete the remainder part of the pacemaker potential. So the pacemaker potential will get reached to the threshold level very fast. So the action potential generation is very fast under the influence of sympathetic stimulation. So heart rate will increase under the influence of sympathetic stimulation, and heart rate will decrease because of the vagus stimulation. It is caused by the hyperpolarization, and there is also the less opening of calcium channel because cyclic AMP is decreased because of the effect of acetylcholine. So let us see the same mechanism. So whenever the sympathetic activity is increased, heart rate will increase because it increases the slope of pacemaker potential. So the norepinephrine, whatever it is released at the sympathetic nerve ending, or epinephrine that is released from the adrenal medulla because of the increased sympathetic activity, both these hormones or the neurotransmitter norepinephrine released at the sympathetic nerve ending acts on the beta 1 receptor in the SA node, and they will open the IF channel, means funny channel, along with the calcium channel because of the increased concentration of cyclic AMP. This cyclic AMP will increase the opening of funny channel along with the T-type calcium channel, through which the pacemaker potential will be completed and it will reach the threshold very fast. So there is an increased rate of spontaneous depolarization. So number of action potential per minute will increase. So heart rate will increase. The reverse will occur because of the effect of parasympathetic stimulation. So whenever there is an increased parasympathetic activity is there, the acetylcholine is released. It will act on its M2 muscarinic receptor. Because of this activation of receptor, there is an opening of potassium channels, and there is also the closing of the calcium channel because of decreased cyclic AMP concentration. So because of the potassium efflux, the cell will be hyperpolarized more at the end of action potential. So the membrane potential, that is pacemaker potential, will take more time to reach the threshold. So there is a decreased rate of spontaneous depolarization. Number of action potential per minute will decrease, and that will also decrease the heart rate. Okay. So with this, we have completed the cardiac action potential. Thank you for watching my lecture. So see you again for the next classes on CVS cardiovascular system.